All righty, we are live.
We are. I was thinking that we would have a countdown or something, but here we are. We're live. I don't. Is anybody out there?
Would you like me to start counting, Rob?
No, it's okay. So we do have some participants. Are we able to know that there are people watching us right now? Can you check that out?
We're live right now. It's up in
Okay,
the corner. You can see that we are live.
I understand. Okay. So welcome to the Real Mushrooms Pet Q&A. I'm your vet, Doc Rob Silver here, and Chief Veterinary Officer for Real Mushrooms. And Joni Camlet, who is a registered veterinary technician, is works with me as Director of Education and Outreach. And the two of us tonight and in prior pet Q&As have been kind of leading the charge here. And of course, we can't lead the charge unless we have some ammo. And the ammo are your questions. And this week we actually got a bunch of questions, so it should be pretty fun. I really enjoy these quite a bit. I hope everybody else does too. We get questions beforehand, and everybody and Joni and Jordan check them out. I don't want to see them. I like to get them. It's like stump the stars.
Yeah.
So anyway, so tonight, and with each pet Q&A, we want to do just a little theme at the beginning, a little kind of educational explanation of something. So tonight we want to talk about integrative veterinary medicine, and I'm the right person to do that because I'm an integrative vet. And when I went to vet school at Colorado State University and I graduated in 1982, the word integrative vet didn't exist. At that time, they did have the word holistic. And holistic care interested me a lot, and I pursued that as I got more frustrated with the limitations that I found with conventional medicine. I was looking for more tools to help my patients. And as I got more into these alternative approaches to health, I started getting better successes, and it got me really excited. And so I've been really a strong proponent of blending the best of Western medicine, so to speak, or conventional scientifically based medicine with complementary therapies, with alternative therapies. But I'm very careful to use only those types of alternative therapies for which there's good evidence that they work. And the reason why we emphasize evidence is, if I'm your veterinarian and you're bringing your beloved animal to me and they have potentially a terminal disease, don't we want to use an approach to that disease that has some scientific evidence that it actually works? Instead of wasting our time with something that somebody somewhere, some Joe Blow said, hey, this stuff works pretty good, why don't you try it? So that's really what I think the definition of integrative medicine is, which is choosing the best therapies from both modalities for the individual nature of that patient's problem. And a follow-up to that is that we don't really treat diseases in integrative medicine. We treat the patient who has the disease. And this is because you could have a diagnosis, let's say diabetes, and you could have 10 different patients that all have that diagnosis, but each of them is a little different and needs to be treated individually as they are, not as a diabetic. So that's where I think the therapies are very robust and very helpful. And I think that's one reason we're seeing such a huge upswell of public interest in these types of therapies. I mean, look at how popular the Forever Dog is. It's really talking about blending the two, about integrative medicine, heavier on what are these, evidence-based complementary therapies, but nonetheless, that's what Dr. Becker and Rodney are doing with that book as well. So I think that's probably enough, isn't it? I get long-winded. Shut me up when it's time, Joni.
I will never shut you up, Dr. Silver. I love listening to you, but I really appreciate you talking about that blending of the Western and the complementary therapies. And the way I've always looked at it is it's just more tools in the toolbox. Like when you have an animal that's sick, or you have, it doesn't even have to be an animal that's sick. You have a new puppy and you want to take the best care of it that you can. Wouldn't you feel more comfortable knowing that your veterinarian has all the tools in the toolbox, not just the Western tools, not just the integrative tools, like all of the tools, and that they're well versed in all of them? one of the things, when I started out in veterinary medicine, 25 years ago or so, I went straight into integrative medicine. I had an experience that got me interested in, back then it's called holistic medicine. And I went to school to become an RVT, but I was like dead set on doing holistic medicine. And very quickly I realized that was not going to be the whole picture, that there was so much more that we could do to help pets when we looked at everything, when we didn't rule anything out. We looked at that animal, the whole animal, like you're describing, and figured out what was going to be the best for that case. And, particularly things like emergency medicine, that's where the Western medicine really, really shines. But so I think it's great that you're talking about this idea of the integration of the more natural therapies that are, and at the very best, that are evidence-based with conventional medicine. And and the more educated pet parents become, the better choices they're going to make about which therapies they want for whatever's going on with their pet. So anyway, I'm long-winded too there, Dr. Silver.
Okay, and not to want to make this too long, because I know we've got all these questions to answer, but to borrow your metaphor about more tools in the toolbox, there's a professor of, or was a professor of psychology at Brandeis University, Abraham Maslow, and he's famous for saying, when the only tool you have is a hammer, everything looks like a nail. and so I have actually a picture of a toolbox with one hammer and a nail in it and nothing else. And I use that as one of my slides when I'm talking to veterinarians about integrative medicine. It is more tools for the toolbox.
Totally. I want a big fat toolkit. I want one of those like giant Craftsman that like you on wheels.
You can have that.
Yeah. But anyway, moving right along, before we get into the questions, do you want to share our exciting Real Mushrooms veterinary pet formula news?
Well, they just spoiled it for us.
Magic shows up right on the screen.
Mm-hmm. So yeah, as we are developing the pet line, and it's a work in process, the first thing that we wanted to do was to make sure that all of our individual and our blended 5 defenders was in a capsule format for pets, and capsule sizes that were a little smaller to accommodate the smaller size of pets than the adult size. So we finally have chaga and cordyceps available, and that's just awesome. And we have had those in the pouches. And we do have a number of these single mushrooms and the 5 defenders also available in pouches. And depending on the palatability with your pet, it could be a cost-effective solution. We'll give you hints about things that are coming down a little later in terms of this development of the pet line. And we are always open to suggestions. We want to know what the needs are out there so we can fulfill them. So if you want to, contact us one way or the other, carrier pigeon, whatever. The mail works pretty good. Yeah, try that. But yeah, chaga and cordyceps, are they now available for sale, Joni? I heard they were in shipment.
They're on the website.
Oh, sweet.
Pretty exciting. Yeah, I was on there today, and like there was the cordyceps and the chaga, which I'm personally I'm really excited about the cordyceps.
Yeah, I'm taking quite a bit of cordyceps myself.
Yeah, and I just love it. I want to hear. Can't wait to hear from performance animals, agility dogs, police dogs, military dogs, dock diving dogs, all the truffle hunting dogs. I mean, all the different types of canine athletes out there. I think cordyceps is going to be a really great addition, in addition to supporting the lungs and the kidneys and all kinds of other things as well.
Yeah, cordyceps have a number of very remarkable properties. Interestingly, that I've discovered that cordyceps not only helps to increase your performance, your stamina, your energy by generating more ATPs, it also has a settling effect on the brain. So it's like it doesn't excite the brain; it just gets the body ready, and the brain is calm and able to do things. So it's very it's neat that way.
it's a cool mushroom for many,
it
many
is.
reasons, which I'm sure we'll get at I mean, it's the zombie mushroom. How cool is that? But
What, because the zombie, I've never heard that one before.
you
What is
haven't
that?
heard of this, the zombie mushroom? Oh, yeah, because
No, I
yeah,
live in a cave somewhere.
yeah, like every Halloween, cordyceps, they roll the cordyceps out because well, not our cordyceps. They figured out now how to cultivate cordyceps without having to use an insect as a host. But the cordyceps takes over that insect and
Hmm.
basically, yeah, it's like turns them into a zombie, kind of.
Hmm.
If you
Well,
want
it's true. Isn't
to.
it true that if it infects an ant, the ant will climb all the way to the top leaf of a bush so that it can disseminate the spores better that way with the wind. The mushroom takes over the nervous system of the ant and drives it to climb to the top of that plant. I hope it doesn't do that to us.
Yeah,
It won't. It
That's
won't. It
the
won't.
truth.
That's actually the mycelium, not the actual fruit body or the mushroom itself.
Isn't that the truth? And we actually, Dr. Silver, we actually have questions coming in live as
Excellent. Well,
we like.
yeah, I guess we better get to work here, huh? All right.
But actually, and we have some
Here's one right
questions that are
here.
being put up. I just wanted to, since we're talking about cordyceps, Carrie live is asking which mushrooms are best for upper respiratory issues. Since we're
Okay.
on the topic of cordyceps,
Mhm.
would you say that cordyceps would be? I'm finding it to be an excellent upper respiratory mushroom currently.
I think that you actually could choose from a number of our mushrooms and not go wrong with that. I think if you want some antiviral activity, look at things like the turkey tail or higher doses of the reishi. You
Mhm.
know, if you're looking for something that's specifically for the upper respiratory tract. You might also, there might be some, allergy issues with the upper respiratory, in which
Yeah.
case looking at reishi or looking at chaga, because they both have antihistaminic properties, could be good. I don't really think you can go wrong with that. You just want to make sure you're using a higher dosage if you're talking
Right.
about an issue which is an infectious issue or a very strong inflammatory issue. And I guess I need to say this at the very beginning, and I forgot.
Oh, yeah.
My disclaimer, which is that as much as I would like to give you specific medical advice for your animal, really ethics and a number of practice acts keep me from doing that. And it's not really appropriate. I would really need to examine your animal and examine the medical history and look at everything else in order to help you properly. And I wouldn't want to give you advice that wasn't
Yeah.
good advice.
We
So these are generic answers in general about, if your animal has a problem and you're asking me about it, I won't tell you what to do for your animal, but I'll tell you how we would approach that problem.
Yeah, we'll give a kind of a general idea. And
Yeah.
in general, I just want to suggest, and then we'll finish up with you, Carrie. In general, I'm dealing with a general upper respiratory virus right now, and I'm finding that when I take the cordyceps, seems to be really helping with. I could feel my lungs feel clearer. I'll put it that way.
And you're post-COVID, and the
I didn't want to say the word.
It's okay. Well, I'm sorry, I didn't mean to to say.
Oh,
that.
no, I just didn't know what we were allowed to say actually on
Really?
live.
I don't. I didn't know if that was. I don't really know.
Right.
But the cordyceps, not just in terms of it's being directed towards the lungs, but the very high beta glucan content that it has also will work systemically to help your immune system better combat these post-COVID issues you're dealing with.
Yeah. So let's take some of the questions, because I know people. We're going to take the questions of the people that are writing in right now, but we do have some questions that people have written to us over the past week, actually over the past month, and we want to make sure that we address them because they've been waiting patiently.
Sure.
My dog Rue was diagnosed with IBD and inflamed rectum. The vet wanted him on antibiotics, prednisone, and cyclosporin. What would you suggest in terms of both holistic and traditional medicine? Mm.
Oh, I think this is this is one conventional approach to IBD, and there could be other choices of therapeutics. I think the cyclosporin is probably the most important part there in terms of helping with the immune issue, the immune inflammation. Prednisone over time may wind up becoming problematic. Initially, it'll give some immediate relief, so maybe short term that. And the antibiotics probably just for the inflamed rectum, pretty short term as well. So, IBD is a complicated issue. There may be risk factors involved with some sensitivity to certain dietary
Right.
foods that you're taking in. So I always think it's important to do a test of what food ingredients might be problematic in terms of stimulating the immune system in the bowel. And I suggest looking at the NutriScan, which is nutriscan.org. This is a saliva test, and it measures IgG and IgM as compared to IgE. And so it works a little better than the blood tests in terms of identifying the true offenders, if there are those. But that'd be the first thing, because that's something we can all fix, is the diet, one way or the other. Then, looking at, holistic approaches, it's known that CBD can be very helpful as an anti-inflammatory for IBD, and it's widely available. So that may be something that you'd want to avail yourself of. You should dose it fairly high, starting low and working up to a dosage of about a mg per kg twice daily with some food. And then looking at our mushrooms, I think looking at at one of our mushroom products, which has a fairly broad spectrum of activity and good anti-inflammatory activity, I would look at something like lion's mane or the five defenders, or possibly a combination of both of them. The
Or the
lion's mane,
chaga, right? Maybe the
sorry?
chaga. Maybe the chaga too, now that we have it in the lineup.
True, lion's mane and chaga would be one approach. I was thinking in terms of the lion's mane and the chaga that's already in the five defenders, plus the benefit of the reishi and other mushrooms that may all work together in a synergistic way. But really, we don't have studies that support that these are specific for these specific diseases. So I'm basing my recommendations on what I know the activity of these mushrooms to be, and this diagnosis here. I think diet's very important, and there's a number of supplements that a person can use to help reduce inflammation, certainly getting some support for the microbiome. And mushrooms also contain a lot of fiber, which will also help feed the microbiome, but also perhaps adding some fermented vegetables, perhaps looking at some of these probiotics they have available. There's a company called Animal Biome that uses the fecal transplant concept. That has actually capsules that contain freeze-dried feces from healthy dogs that would re-inoculate the bowel with good bugs. So these are the kinds of holistic approaches that I would suggest looking at. There's a lot of different supplements. You can't really give the animal a lot of supplements because their bowel is so sensitive that even giving them something that's good for their bowel could upset their bowel at first. So you have to take baby steps, and you have to take them, a little bit at a time. The optimal dosage might be 4 times higher than what you start with, because you don't want to upset the apple cart with it. So it's complicated. You should find a holistic veterinarian to help you with this, because it really needs that kind of detailed attention.
I agree. It does need medical management. And having just gone through something similar to this with my own dog, and thank you, Dr. Silver, for kind of holding my hand through that. One thing that I did not want to give the antibiotics, and I ended up doing a 10-day course. I'm glad I did. But also, I added things back into her diet after her being on a bland diet so slowly. And every new supplement that I added back into her diet, I do just the one for a few days and then add another, and she's now back to 100%. But it's very complicated, and definitely needs. It's the dog can be so sensitive once that kind of IBD cycle kicks in. So patience and making sure you're working with somebody who can guide you through. And I love the idea of the animal biome,
Mhm.
or the gene, the NutriScan test. Absolutely. So I hope
Yeah.
that helps. What is our next question? Oh, my dog suffers from fly bite seizures. While
Mhm.
foods and no animal protein, seizures have reduced from 12 per day to less than 1. Wow. Can any mushrooms help him?
Um, I don't know, honestly. Mushrooms are not specifically known to be helpful with seizures. If I had to choose a single mushroom, it would be lion's mane because of its concentration in the brain and its ability to address neurologic issues. But you know, if your dog is seizuring 12 times in one day, it needs to be on medication. That's not being kind to your dog to allow it to seize that many times in one day. And I'm saying this as a veterinarian with concern for your pet, as I am concerned for all animals.
Well,
So I would suggest that you reach out to your veterinarian. And I don't know the details, but I really think getting some medication would be a good idea. It's good that changing the diet has reduced them from 12 to day per less than 1. Sounds like there may be some dietary factors involved here as well. And as I mentioned with the IBD dog, you may actually want to run a food panel to see if you could find out not just which are the, whether it's animal, whether it's a vegetarian or diet, but to find out what are the specific um, ingredients that might be creating that inflammation that's driving the fly bite seizures. What they are is those are petit mal seizures. And the dog looks like it's like there's a fly somewhere it's trying to bite at it, but it's really, it's really a seizure. But it is not a grand mal; it's petit mal.
yeah. And I would agree with you, Dr. Silver. Like uh, it seems like lion's mane would be helpful, but honestly, from the feedback I've gotten from veterinarians and from like pet parents that have been using the lion's mane for seizures, I wouldn't say that it's like knocking it out of the park or anything like that.
Mhm.
Um,
Yeah.
I wouldn't rely on, I mean, certainly worth a
Yeah.
try, but
I think she'd have more luck with CBD actually. And just as in a way, IBD and epilepsy is very similar, in this regards, because some of the same risk factors
yeah,
drive both problems. Only in one animal, the weak spot's the bowel; the other animal, the weak spot's the brain.
yeah,
But yeah, that sounds like quite a bit for you
yeah.
to deal with. I'm sorry.
So I think why don't we take one of the live questions that's we'll mix it up a little bit. We have
Okay,
our
sure.
wonderful Jordan Swain is our wonderful person behind the curtain who's putting who's helping us with these questions. And so Debbie, I know Debbie had a couple questions. One of them being, when are supplements too much? Everyone is selling a lot of great things, but after a while the list is long. And I know Debbie, you also posted a list of all the things that you're doing for your pet, and wanting to know what to give and what to stop. I don't think Dr. Silver can really give you that kind of feedback, but I don't want to speak for you, Doc Rob.
Well, I can. It's a lot there, and I need to know more details of your animal. I'm not really in that position to do that. But there's a lot of marketing out there, especially on Dr. Google, selling stuff, and a lot of the stuff is really good. And they say this is good for IBD or this is good for that, and and consumers like yourself wanting to give the best to your animal are concerned when they see the problems that your animal has and want to solve it. But there really has to be a process that you use in order to address the problem in your animal. And that's where speaking with someone who has some experience and who understands the problems, like a holistic veterinarian, integrative veterinarian, to use our newfangled term, is probably going to help you sort out which supplements are going to be helpful. And just as I mentioned with the IBD dog, sometimes the supplements, as good as they are, just by giving them can create, by something new can create a problem. How do you know what the dosage is? There's so many factors that I really think that in the long run, in spite of the cost of seeing the veterinarian, it's going to save you money because you may not need all of the supplements. There might be just one, there might be two. I don't know. You don't know what the problem is and all. So I would suggest that you find one. And there is a source that you can go to see if there's a veterinarian in your area. And the American Holistic Veterinary Medical Association, www.ahvma.org. If you go there, and hopefully Jordan will put that address up there pretty soon, one way or the other, they have a button that you press that goes find a vet. And it'll have them listed by what they do and by their state. And hopefully there's one close enough to you that you can go to them, get an appointment set up, and have them evaluate what you're giving, whether it's helping, whether it's not, help you to filter it down, and find out more details, more in-depth understanding of why your dog is doing what it's doing that's driving you to all of these supplements and diets and, things that you're buying online, and taking the advice of people that are just selling stuff to you versus taking the advice of a medical professional.
I will also add, ahvma.org is great. Real Mushrooms, we also have a list of veterinarians
That's true.
who use mushrooms in practice. Some of them do telehealth. And so our wonderful Jordan, I know if you could put the email address for people to contact us for that, if they want to get that list. Debbie, I will say that I love that you're rotating the food, that you're rotating among the beef, chicken, turkey, and lamb. And, honestly, as somebody who's been rotating food now with my dog with my pets for 20 years, they never get the same thing in their bowl. There's something different in the bowl every meal. I think that goes a long way towards covering bases as far as like nutritional, cutting down on any nutritional deficiencies and stuff like that. And often that can be really big. Yeah, I agree with Dr. Silver. Yeah, work with a veterinarian. See, you might have just the right amount of items, and you might be able to cut some of that down or change it. Yeah. So hope that helps, Debbie. What is our next question? Oh, look at you! You're so good. From Julie Jeffrey, are there topical uses for mushrooms? If so, do you have any plans to make ointments? Interesting.
I have read a couple of studies that have used topical mushrooms for rashes and those types of issues. And certainly that would be something that we could do. As a veterinarian who's been designing products for pets for the past 25 plus years, I will say that these ointments can be can foul the hair, because our patients are all hairy. Don't have naked skin, which makes it easier to apply the ointment. So, if there's a hot spot or an area on an area of skin that doesn't have hair, certainly an ointment then could be good. Sometimes in the ventral abdomen, we can have that, and the nose, and maybe sometimes around the ears. Not in the ears. I'm not talking about ear infections. But I just find in general that topicals are more problematic. And so it's not something I've had a big interest in doing because of that problem with the hair.
Yeah, the hair is definitely an issue.
It is, yeah, it is. And the same thing for CBD. I've been working with CBD for many, many years, and and it's easy to make these salves, and they're less expensive than the oral things, but it's just fouling that hair coat that is the issue for me.
Well, and it's not just the hair; it's the fact that the dog's tongue. You put anything on the body, and then you have to either use a cone or cover it, or it can become problematic because dogs. that they just
But
want to,
it would
yeah.
be a good way to get it into them
Well,
orally.
yeah, yeah. And that's what, that was that great, one of the great
Mhm.
tips. I forget who
For
shared
a
that.
cat, for
Yeah,
a
for
cat,
a cat,
right?
if your cat won't eat the mushroom, like sprinkle it on their coat and let them lick it off.
Mhm.
I love that.
Mhm. I love how cats clean their faces by licking their paws. Like it's so cute.
Yes. So the next question, how many grams of Five Defenders can I give my dog daily? I have a 55-pound and 70-pound dogs, but also foster puppies and dogs for rescue. It sounds like your house is busy.
So Five Defenders has what? It's about 20% beta glucans. So each gram has 200 milligrams at 70 pounds. Where's my calc? Sorry, I can't do it in my head. But thank goodness we've got calculators now.
Yeah.
And this is just for wellness, correct? So let's just do 2 point, oops, 2.5 grams. So that would be, um, I'd say about a third of a gram a day for your 70-pound dog. And let's see, a half a teaspoon contains 1 gram, right? So I wouldn't really get very granular about making it exactly right for your 55-pound or your 70-pound dog. I would dose them probably about the same with half a teaspoon per day. If they have an issue that you feel you need to address that might need stronger, then you could double that or triple it. These are very safe, but you don't need to use more if you don't need more. It'll be more cost effective to use the right amount. These are very, very potent extracts, highly potent, and so you get a lot of bang for your buck with these guys.
And that would be what, 2 capsules at the 300 milligram real mushrooms for pets capsules? If
Well, let's see, 300. If it's a 300 milligram capsule, it contains what 75 milligrams per capsule. So yeah, I'd say about a capsule a day for each of those, just for wellness. That's the low end of the dosing. That's 2.5 mgs per kg of beta glucans. So I'm using that as my guide for dosing them because we don't have established dosages for the other active ingredients in the mushrooms, and all of our mushrooms are standardized to their beta glucan content. So that means that dosing at that level gives us a standardized dosage that also contains a standardized amount of the other actives that are in it. So for now, until we can get actual dosing studies done for different conditions and for different mushrooms, I think that's our best bet as far as some numerical guidance as far as how much to give.
and it can get a little tricky because there's such a wide range. The safety range for mushrooms is very
Oh,
wide.
they're
I
very
mean,
safe. Yeah.
They're fun. They're basically functional foods. So, I mean, of course, whenever
Mhm,
you add anything to your pets or your dog or
mhm,
cat's diet, you can risk gastric distress because you're adding something that, it's like
mhm.
that's novel to them. But, other than that, like you can't really like overdose an animal on mushrooms. You can upset their stomach by giving too much.
I think it's also a really good application for your foster puppies and your rescue dogs, especially because many of those puppies that have been fostered or rescued, um, their immune systems are suppressed by that stress. There was a study in Eastern Europe where they had shelter puppies that they were able to confirm they were all immune suppressed from the stress of being abandoned or whatever their history was. And when they gave them rabies vaccinations, they were unable to mount a protective level of antibodies. Then, when they preconditioned them for a month with um, with beta glucans from a mushroom, the oyster mushroom in this case, they were able to get very good protective titers for rabies after that. So I think, especially for your foster puppies and your rescue dogs, I think it's a real good idea. The Five Defenders is a good choice because it's sort of a shotgun. It has a little bit of each, and very strong amounts, not too little amount of each, but substantial amounts of each, enough that you get a good smattering of the actives from 5 different very potent mushrooms. So it's a good choice.
And how, so that leads to the question with puppies, how early can you start with giving them mushrooms?
When I adopted my first black lab years ago, um, I got some reishi mushrooms, some dried reishi mushroom from Chinatown, and I started even as the puppy that he came in, this 7 week old, 8 week old puppy. I started feeding him homemade food, and I cooked up those mushrooms in his food at that age, and he thrived. So I think you can supplement them as early as they're willing to accept it. Certainly, probably post weaning, and post weaning in these dogs is maybe 6 weeks. 8 weeks would be better. More a little longer weaning, letting them get a little older before they're weaned, I think is good for their health. Keeping them socialized in the litter till about 10 weeks of age is also good for their social skills. Most people that have puppies, by the time they're 8 weeks of age, they just want to get rid of them, all the poop and the noise and everything else. But if you can hang on to them longer, it makes them better puppies. Our cat was kept until she was 12 weeks of age. She's a purebred cat, and I've never been with a cat that was so personable, so social. I mean, she's like a human. It's crazy, and that's really where a lot of that good behavior comes in if they get to be in that litter with the other litter mates for a substantial period of time.
Yeah, wonderful. Thank
Mhm.
you.
Sure.
Oh, there we go. So that was great. Jordan actually managed to find a question that went with the question I asked. It went away
Sweet.
with the mushrooms for a 10-week-old puppy. So I think
Mhm.
that. So the next question, what is the best mushroom for dogs with allergies, specifically environmental allergies? My 2 dogs have allergies to either grass or pollen / ragweed. It's always worse in the spring and fall.
Well, the mushrooms that contain an antihistamine kind of a principle, I think it's a good idea.
Yeah.
And if it's seasonal, then you really only have to worry about it in the spring and fall. If it's year round, and has flare ups seasonally like that, you might want to talk to a veterinarian about some form of hyposensitization, which used to involve giving shots of the allergens in very tiny amounts, but now they have it in an oral dosage as well. The shots you would give weekly or monthly, depending where you were in the cycle. The oral drops are given daily, and in many respects, it's kind of like a homeopathic in that it uses a very, very dilute amount of that antigen that won't create a reaction, but gets the immune system to get used to seeing that antigen, so it doesn't get all excited and develop the symptoms that we see and associate with allergies.
As far as a mushroom, that would that be reishi? Do you think would that be a good one? Or would that be,
Reishi and chaga are the two
yeah?
mushrooms
So the five
that have been
defenders would be
identified.
a good one, right?
Five defenders would be good because it does have both in there. Yeah, wow.
Exactly. Yeah.
It's been like right in front of my face, and I hadn't put that two and two together. Thank you. Yeah, five defenders. It's a good one.
Well,
Yeah. Uh-huh.
awesome. So Nicole says that I have a senior Cocker Spaniel. She doesn't currently have heart issues, but what can help protect her heart?
Okay. So, so far she's done well. Sounds like you've probably had her heart examined because we can see problems with senior cockers in that regards. First of all, keep her weight down. That's probably one of the more important things. Less work on the heart. Um, and I think just I don't have a specific, preventative for heart disease so much as just keeping their weight down and having a good, healthy diet with antioxidants. Dogs don't get cholesterol buildup in their arteries, so we aren't as concerned about that as just simply keeping their weight within reasonable levels and having them on a healthy diet, hopefully one that's homemade or not processed kibble. Jody, do you have some things you'd like to add?
Well, I was going to suggest the five defenders, which is always a
Okay.
good go-to because the shiitake, I know that
Okay.
the shiitake can be cardioprotective. And I
Okay.
believe I was pulling out I've got my little laminated
Okay.
list. And so I
Mhm.
remember seeing that also chaga, chaga is cardioprotective. So it's not like they're primary role, but they do have those qualities. So,
Hmm.
and also reishi, so
Hmm.
it just seems like the five defenders is just, it couldn't hurt to add that to the
It
protocol.
is. Yeah,
Yeah.
the reishi in Chinese medicine also helps to govern the heart as well. That's one reason why it can be calming when you take it. But it's important to differentiate the fact that animals don't develop coronary artery disease, and so several mushrooms contain um, molecules in them, ingredients in them, which are just like our statin drugs, but they're naturally occurring. In fact, our statin drugs are modeled after the molecules that they derive from oyster mushroom and from shiitake mushroom. So sometimes when we see descriptions that say it's good for the cardiovascular system, they're not really saying it supports the heart muscle or the
Right.
circulation around the heart so much as it supports lowering cholesterol so you don't get into coronary artery disease.
Interesting. Okay.
And so when I was working on my shiitake monograph, that was pretty much what I had seen, but I didn't see that there was specifically benefits for the heart. But I love your your suggestion for the five defenders. It is a good place to go. I'm glad she doesn't have heart issues. I think another way to help protect her heart, because we have very good conventional tools to help address a failing heart muscle. Um, and there are certainly supplements and things that we could look at as well. But I think annual examinations and perhaps an examination with a cardiologist to give you an in-depth look at really what's going on in the heart can prepare you for some disease that might be incipient or that make you feel better that there doesn't seem to be any kind of cardiac issues at all. Cardiologists are really good at what they do. They're a bit pricey in terms of as specialists, but then again, the heart's a very important organ.
Yeah, we all
So
need it.
yeah, in one way or the other.
Yeah.
So anyway, that's my take on it. I'm sorry I don't have better solutions for you.
No. And thank
Mhm.
you for the reminder that like the human indications don't always translate to veterinary. So once
No.
again, one of the things I
Mhm.
love about working with Dr. Silver is that he reminds me of these things, reminds me to always look at the evidence, and
Mhm.
and these are it's one of the things I respect most about you, Dr. Silver, is
Mhm.
that you do really want to have it, you believe in the science.
Well, I have an undying thirst for the truth. I just want to
Yes.
know what is really real, and especially if it's regarding the health of an animal that I have some ability to help. I want to
Yes.
know that I'm doing the right thing. All right, so here we have a mast cell
Yep.
tumor dog.
Yep.
Okay, that's not a medium chain triglyceride dog, I take it. And I think that your choices of, I think turkey tail is certainly my first choice when I'm dealing with with a cancerous event like a mast cell. And certainly you could add chaga to that very well because it does have those antihistaminic properties. Um, reishi is another one that
Yep.
you could also work with there for that. So, in terms of giving your dog a break from supplements, I think it may depend on what the supplements are. Um, for myself, I just get tired of swallowing all those pills every day.
Yeah.
So I give myself over the weekend. I just take the weekend off,
Yeah.
and give myself a break from it. But it's not like the body gets used to it and it doesn't have the same effectiveness. Mushrooms aren't that way. They're functional foods. They're meant to be eaten on a daily basis. There may be some other supplements which may be tough on the body and which you would probably need to give them a break for that. If you're using something like artemisinin to treat the cancer, which isn't as quite as successful as all of the blogs indicate, then we do a week on and a week off with the artemisinin. And we intersperse the week off, we do iron loading to load the cancer cells up with iron so the artemisinin can attack it. So there are some situations where you do that.
Yeah. But not with mushrooms, although rotating out the mushrooms
Yeah,
helps.
yeah. After a couple of 3 months, you might want to switch. Like for instance, do turkey tail and chaga for 3 months or whatever your time base is in terms of the growth rate of that tumor, and then change from chaga to reishi.
Yeah.
That works.
Yeah. Or the good old Five Defenders, which has
Or the good old Five Defenders. Yes.
One thing I love about the Five Defenders, it's just got all the good stuff in it.
Well, the thing though that you want to think about when you're getting the Five Defenders is that you want to be able to have the enough of a dosage of the active ingredient in the Five Defenders that you're interested in. So, if you got a capsule of Five Defenders that's got 300 milligrams in it, but the actual beta glucan content and active contents of the individual mushrooms is much less. So you may want to give more to up the dosage of, let's say, the chaga, so you have that better antihistaminic effect. That would be the only reason not to use the Five Defenders, is that you might have to give more capsules of that to get the same effect from the chaga versus just getting a chaga capsule, which we now have.
Yes. Yay. Awesome. And Heather has a follow-up question. Could you stack Five Defenders on top of each separate mushroom? And
Absolutely.
What is max dosing on turkey tail and chaga?
There is no. The limitation is your dog's acceptance of the capsules in the food, or your dog's digestive system's acceptance of the of the mushroom in its digestive system. But basically, and we don't have a safety study yet in dogs. I'm going to do one. I'm just not certain which mushroom I'm going to choose. Probably turkey tail, because I think for protocols for cancer with turkey tail, we need to use probably pretty high dosages. And so it'd be good to check out to make sure that we have proof that the high dosages are safe. So yeah, no, you can use that. And, I would look at the kind of dosing that I'm recommending on the bottles and on our literature. I think we've got some documents that we send out as well to customers about dosing pretty regularly. And that I would use the higher realm of dosing, which would be anywhere from 10 to 30 mg per kg if you're treating cancer. So, you could go pretty high with that.
Yeah, yeah. And Ronald Hartman just wrote that he's used turkey tail to treat cancer with great results.
Yay!
Is that in your profile pic that you maybe that is your pup that you were using the turkey tail with, and we love hearing those kinds of that kind of feedback.
A lot about turkey tail. I know certainly if I wound up developing that disease, that'd be one of the first places I'd go.
Without a doubt.
In addition to seeing an oncologist.
Yeah. Yes. Of course, you follow your own advice. That's good. Awesome. So, what is our next question, Jordan? Awesome. Any mushrooms that would help dogs with diabetes or high blood pressure?
Well, I think that there is a natural blood sugar balancing effect for many mushrooms. I would look to, and I'm going to go right back at you with this one, Joni. I think the Five Defenders would probably be a great choice there because of the shiitake and the maitake that it contains, which we don't have as individual encapsulated mushrooms yet. We're looking at those. Maybe those are mushrooms that we need specifically for the pets. They're very tasty, they're very palatable, and they're very powerful. So I think looking at Five Defenders would be helpful. Now, when it says help with diabetes or hyperglycemia, high blood sugar, it's not going to solve the problem. If your dog needs insulin, for God's sake, don't stop using it. But what it may do is it may help the dog regulate better. And it may be over time that you might actually be able to sneak that insulin dosage down a little bit. And, there's a lot of evidence that you can treat diabetes with dietary management, but only in the situations where you've got a type 1 diabetes that's very fragile. Even with type 1 diabetes, I'm not saying you can go without insulin, but there are oral anti-hypoglycemic agents. There's herbs that have anti-glycemic properties. CBD, cannabis has that as well. There's a lot of natural things that we can use to help the body better regulate the problem. It might be there just aren't enough cells in the pancreas to produce enough insulin, and that's or they've been destroyed by autoimmune disease or by infection, and so you have to use the insulin.
Yeah. Yeah, no, agreed. We've actually got a few thyroid questions in the chat.
Okay.
So any mushrooms that help with thyroid in dogs? That's a tough one.
Yeah. Thyroid conditions are kind of a broad spectrum, like when each of these categories that we give. And, there's some dogs who have a kind of a low grade thyroid deficiency that can respond to certain herbs. I have not found in the literature anything that supports the use of mushrooms for thyroid disease, but we also know that there is an autoimmune component to much of thyroid disease, including possibly hyperthyroid in the cat. And so, anytime you have an immune mediated problem, mushrooms can help to balance the system and help to improve that. So, I would not tell you that you should use a mushroom specifically for thyroid disease.
Right.
But I would tell you that you can use a mushroom to improve the health of your animal so that its thyroid disease becomes less of a problem.
Yeah. Agreed. Thank you.
Sure.
Let's see. Are these supplements at one time too much? Real mushrooms, joint supplement, berries, extract powder, probiotics, and CBD oil.
Sounds like a good program.
Yeah.
No, that's not too much at all. The berry extract powder, that's food. Probiotics, that's food. The real mushrooms, that's food.
Yep.
So really, your joint supplement and your CBD oil, I think it looks like a good program there.
Yeah.
Actually. Probably if you were to look at the bowl of pills that I take in the morning, you'd say that's too much. And some days it definitely is too much.
Yeah.
But I'm 73 and I look like I'm 45, so it's worth it.
You're kind of like a Benjamin Button. You seem like you're getting younger, Dr. Silver.
The portrait of Dorian Gray.
Yeah.
Let's see.
My 7-year-old dog is excessively licking their armpits and knuckles. On a grain-free diet and take 5 Defenders and Calm Chews daily. We use the Cone of Shame too, but now we're out of ideas.
Yeah. Well, this sounds like it is some sort of a dermatitis. To say that it's an allergy, I don't think would be appropriate. There can be, at these joints, we can see issues with inflammatory skin conditions which aren't driven by allergies. So I would say you should probably find out what it is from a dermatologist who's more likely to be able to give you a precise answer. Again, specialists can cost money, but I believe it saves you money because you find out what it is and then you can target your therapy to help it versus buying a lot of stuff that isn't really working for that.
Yeah.
Doing a saliva test, like we mentioned before, to see if there's a food component in terms of allergies, and at least we can diagnose allergies if it's there. So, it'd be good to see if that's a problem. It could be inhalant allergies, but generally that the distribution of lesions, armpits and knuckles, it sounds more like some kind of an inflammatory dermatitis. So, the grain-free diet, that's good if the animal has problems with grains. The 5 Defenders and the Calm Chews are great because they're going to help improve immune system function through the use of many mushrooms that are in there, and it's going to help kind of settle them down a bit. I read a study recently where they were using a fairly high dose of CBD. That seemed to help, about a milligram per kilogram, which is like half a milligram per pound twice daily. Fish oil can be very good. Using a pretty high dosage of fish oil over several months to have it build up in the body can help as well. There's supplements like quercetin and turmeric, which can also help with inflammation. Looking at the bowel and microbiome. But the licking of the armpits and knuckles, that's some sort of a skin problem, and there is not like a generic treatment for all skin problems, and that's why it's important to know what it is.
And
yes, please.
if I can just, this is probably not, it's probably not this, but I'm going to put my rehab hat on just for a second and say that, you also have to be aware that when an animal is licking a particular area like a knuckle, that
Good
it could
point.
be related to pain
Good
because,
point.
think about it. If your wrist was bothering you, what would you be doing? You'd be kind of with your hand, you'd be like pressing on it or like, when you have pain, you kind of like you want to rub it,
Mhm.
right? Well, dogs can't
Yeah,
do that, so they use their tongues. And the fact
true.
that it's the knuckle, I mean, the armpit's a little, but I would definitely want to rule out that this isn't an issue where there's some sort of pain or inflammation, and the dog
Hmm.
is licking to try to address that pain. Um,
Wouldn't you see them limp a little bit though? Maybe that would be
Maybe,
a
maybe not. It's hard to,
okay.
also,
Mm.
you would
Yeah,
think, but if it were even like a nerve pain or something like that,
true.
something
Yeah,
like that. I
yeah,
know
good.
when
Yeah,
I
like.
when my carpal tunnel's acting up, that's what I'm doing. I'm
Mhm.
kind of pressing on that area, uh,
Right.
trying to address that
Yeah.
kind of
Of
nervy feeling.
course, I know I saw elbow, but it's armpits,
Yeah.
and that is an area where you can get a lot of dermal inflammation. And when they're talking about the knuckles, they might actually be talking about the
Right.
interdigital
Right.
spaces, which is also a very common location
Oh,
for some
absolutely.
sort of a dermatitis. But
Yeah.
but
No,
that is a good point, Johnny. Good
I
point.
definitely think that I would lean towards it being a dermal issue, but I just wanted to
Hmm.
put that out there for anyone
Yeah.
who's listening who has a dog who's licking.
Hmm.
Don't rule out that it could be licking related to pain, depending on the area that it's happening. Um,
Yes.
so I love this. What mushrooms would you recommend to support kidney health? This person's guessing five defenders.
Well, that's like if we had a multiple choice questions, and we always had five defenders in there. People would always check that out. Five defenders is a very good mushroom blend for a lot of purposes. However, for kidney health, I would
Yes, we have a
suggest
new
our
one.
new cordyceps because it is specifically good for the kidneys. We have good objective scientific research that actually shows improvement in kidney parameters for kidney problems with the use of cordyceps. I
Yeah.
wouldn't use it as a standalone. I mean, that we need to know if there is a problem or you just want to be proactive about it in the future. But there are other things we could use as well in addition to mushrooms to help with kidney health.
Yeah, yeah, cordyceps definitely has an affinity for the kidneys, so
It
definitely
does.
something to
Hmm.
consider. Absolutely. Oh, wonderful. You have a 1.5-year-old Skipper I love Skipper. Had squamous cell carcinoma on her toe, and it was healed completely in 12 weeks with turkey tail.
Wow.
We love hearing that.
Cool.
Um,
But I saw a prior comment from Ron that the dog that he mentioned that he used turkey tail with, did pass away eventually, but lived for 2 years, which is really
Years.
remarkable.
Yeah,
Mhm.
yeah,
Very remarkable.
yeah.
Yeah, I agree with you. Early intervention is the key when it comes to cancer, and oftentimes we don't see it, and that's why visiting your vet annually, getting blood tests, which might show something, I think is very important to be proactive and get ahead of the curve when we're dealing with these really
Yeah,
nasty diseases.
yeah. I want to drop down to Sandy because she has been hanging in with us for this entire
Okay. Yes.
Facebook Live. She was our first person that was on,
Mhm.
and she's asking
Mhm.
about wolf poria,
Okay.
which is such an interesting mushroom. Um,
Well, Lophoria is a very interesting mushroom. We primarily use it as its sclerotium, which is a mass of mycelium that grows underground at the roots of trees and will occasionally send up a mushroom, but usually not. And the poria itself has some very specific properties for digestive health and also for kind of harmonizing a formula. So we tend to see poria very commonly in traditional Chinese medical herbal formulas. And there's an interesting thing about the poria because the Chinese doctors were able to find that there's one part of the poria which has a very relaxing and calming effect on the system. And then the other part of the poria is more for the digestive center of your body in terms of supporting that. I'm sure Joni has some things she'd like to add because pori is one of her favorite.
Oh, no, no, I
proteins.
just know. I think you've covered it, Dr. Silver. I'm just excited about maybe one day we will have poria in one of the formulas you're making. So
Well, poria, I think, is good as an added ingredient. I think it can help make everything go better. In the same way that licorice root is used commonly in Chinese herbal formulas to kind of harmonize all the herbs together.
yeah,
Mm-hmm.
yeah, and it's such a mild tasting. From what I've
Well,
heard, it's actually
it's totally bland. It's like powder that has no
yeah,
taste.
yeah. So
I was hopeful I could use it to blend out some of the more troubling tastes of mushrooms like the reishi. And so I've been experimenting with that here as a med scientist here in my basement lab. But the poria has no flavor at all, none. So you can't use it to mask anything. It just would dilute out the taste.
yeah, kind of like it's the tofu of mushrooms.
Good point. Mm-hmm.
Yeah. So we're out of time. I do want to quickly answer Rachel's question here about the best overall mushroom for a 19-year-old.
And I think you're in the best position to answer that one, Joni.
Lion's mane, is that what it was?
Oh, well, we don't know that there's any problems. So I would just
the 5 defenders. You want? Oh, okay. Yeah. Well, I was just thinking lion's mane because it's an older dog, but yeah, we don't know that there's any issues. So yes, I think I agree with you, Dr. Silver. The 5 defenders would be a great overall mushroom for any age, from puppies all the way up to 19-year-old and beyond. But if there's any cognitive issues, then I would recommend the lion's mane. Yeah.
Do we have to end exactly at 6, or can we answer these questions? These people are coming in with more questions. We really appreciate the questions, and we look forward to being here next month again, and with new questions and more fun. Stump the stars here.
We can answer a few more. Do you want to answer Hope and Emma's questions? Because Emma wrote in caps, so we've got to answer her question.
Okay.
We'll answer Hope first. I'm joking, Emma. Thank you about the kidney support answer. My colleague Hound Mix has an incredibly sensitive stomach, and I'm really hoping he tolerates mushrooms. I know they would be helpful for so many things. Plus, he's 12 now, and I'd like to try lion's mane too.
Well, all I can say, Hope, is to go very gradually. If you get it in a capsule or whatever, I don't know what size. Well, a collie Hound Mix, so he's probably 50 or 60 pounds. So you could probably start with with half of a capsule. Start with so small an amount that and then I would gradually start to escalate that and increase that. And there are some things that we can do to help sensitive stomachs, depending on what kind of sensitivity. Sometimes ginger root can be a very effective solution for that. Sometimes things like marshmallow root, which is soothing, or aloe vera juice can be very helpful if you've got kind of a gastritis. So, you may want to reach out to a holistic vet to help you with that, or an herbalist.
Yes, absolutely. And yes, we will keep a good stock of the 5 defenders. We always do. And just so you know, the 5 defenders comes in the capsule form, and it's also in the immune chews. So we do have 5 defenders in 2 different, like the chews are a combination of 5 defenders with all kinds of wonderful immune supporting herbs that are in. It's in a tasty chew, or you could do the 5 defenders in a capsule. And so Emma was wondering, where do we get them? Well, we are Real Mushrooms, Emma. And Dr. Rob Silver here is the formulator of Real Mushrooms for Pets. So if you go to realmushrooms.com and click on the pets, I think it's the pets link, you'll see all the different products that we have for pets. Although I should say all the Real Mushrooms products, with the exception of the chocolate. Don't give your dog the hot chocolate. all the Real Mushrooms products are safe for animals.
Mhm.
Do
And,
that.
and if you have more questions, you can reach out. We've got some contact numbers. And Jordan, who is running the show tonight, she runs the show when it comes to customer support as well. So you'll get well taken care of if you have more questions.
Yes, absolutely. And this will be to the person that came in late. Yes, as soon as this is over, I think it goes on the Real Mushrooms Facebook page, and you can watch it again. And by the way, folks, if you don't know it already, we have a new Facebook page called Real Mushrooms for Pets. And so you can go to Facebook and search for Real Mushrooms for Pets, and it's a pet-specific Real Mushroom private page. And tomorrow I'm going to be posting this beautiful ebook that Dr. Silver put together, where we kind of detail out each of the mushrooms. We even have some really wonderful mushroom recipes put together by an amazing woman named Susie Bieber. And so I'm going to be posting that tomorrow in the documents. And it's just a really great reference to learn more about like mushrooms, which mushroom for what mushroom to use for what, basically, and how to pair them together.
Yeah, and we had a horse question, and right now I'm developing our protocols for horses. So I can more speak to you in terms of what your needs are. But we do want to expand to horses. Right now, we're pretty much focused on dogs and cats. But but horses are very important to me, and I want to be able to help them as well.
Yeah. Awesome. And I think we should cut it off here because my little dog Scruffy's hungry and she's like, I've got to feed her.
Yeah, it's dinner time here too.
Yeah, awesome. Well, listen, everybody, thank you so much for joining us. We do this every single month, 7 o'clock Eastern time, 4 o'clock Pacific time. And you can come on live and ask questions. You can also send questions in advance. Anything else you would like to say before signing off, Dr. Silver?
Eat more mushrooms.
Eat more mushrooms. There you go. All righty, everybody.
Great. Good night, everybody.
Good night.